Let's talk about PPIs. So this is a question that I get asked a lot. So PPIs, or proton pump inhibitors, these are medications like Prilosec, Nexium, Protonix. They basically work by decreasing the amount of acid that the stomach is making. So first of all, I don't want people to be on medication if they don't need to be on medication, right? But we know that not treating acid reflux adequately and just allowing that acid to continue getting into the esophagus puts patients at a higher risk of things like Barrett's esophagus, which is actually a precancerous change in the esophagus. So I don't want people on medicine if they don't need to be, but it is going to be far better for us to treat people adequately, even if that means they're on medication indefinitely, than to just ignore it and pretend like it's not happening. But in terms of the risks, so because we are decreasing the acidity of the stomach, there is a chance that you could struggle to absorb certain vitamins, minerals, things like that. The population that we see the biggest issue with is older women, because we could potentially decrease the amount of calcium that your body is able to absorb, which could lead to things like osteoporosis, which could potentially lead to increased like fractures and things like that. That if they do have to take a daily PPI, that they're also taking a multivitamin that has a good amount of vitamin D and calcium in it to kind of help counteract that effect. The other risk that we do see is that it does put you at a slight increased risk of certain infection known as C. diff, which is Clostridium difficile, and it's infection of the mainly of the colon. I see that this is more so an issue in people that are already experiencing problems with C. diff, whether they're a colonizer or they've had C. diff in the past that was kind of difficult to get under control or get rid of. I have rarely seen somebody with C. diff where the only possible cause or the only likely kind of etiology was because of these types of medications.